Record.
So I was just going to ask if it's okay. I'm having some issues with my internet, and I apologize for doing this right when we're getting started. Tony or Jody, would you mind just maybe sharing a phone number that I can dial into? Because I don't want to miss out on any questions or anyone's questions or responses either. I think that might be the best way to go.
Phone number for the session. Yeah, give me 1 minute while I am digging up that information. I will chat it to you, Dr. No. Do you feel comfortable going ahead and introducing yourself while I'm pulling that up?
Yeah, of course. So hi, everyone. I wish I can see all of your faces, so feel free to, I guess, put yourself on video at some point. I'm looking a little rough myself here. It's 9 o'clock at night, so I'm not sure what everyone else's excuses, but anyways, I'm just giving you guys a hard time. My name is Hugh, and please call me Hugh. It's much less evil than calling me Dr. No. And for all of you James Bond fanatics, I am a Touro graduate. I will spare you the year because then you'll start doing math and then you'll just learn about just how old I really am. But I'm delighted to be here. I was just telling Jody before we had all of you guys join, I just recently contacted Dr. Debbie Sasaki-Hill and said to her, you know what, I miss having, an opportunity to get in contact with her. Speaking of Dr. Sasaki-Hill, there she is. I told her, I miss an opportunity to really be part of the Touro family and, just give back to Touro what they've given me. And so I said, here's my contact, here's a few ideas that I have. And lo and behold, here I am doing an alumni session. So I have Debbie to thank yet again.
Hugh, see the blue bridge?
I do see the blue bridge. I was just going to make a comment, and it's very reminiscent of that thing that I crossed only 100 times a day back when.
Well, thank you so much. I'm sorry to interrupt, but thank you so much for joining us. When Dr. No was a student here at Touro, he was a star. He was the ultimate student, and he did so many things to help us, including being a mentor to a lot of the students. So please, if you have any questions about pharmacy school, about being a pharmacist, Dr. No is the ultimate person to ask. So thanks very much. Sorry to interrupt.
No worries at all. Thank you, Dr. Sasaki-Hill. Yes, I would even say in terms of advice, I'm probably a little bit more helpful to everyone tonight by just talking about my own pharmacy school experiences. And then I see that Jody has just shared with me her, or the contact for the dial-in. So guys, if you wouldn't mind just giving me a quick minute here, I'm just gonna call in because my audio is having some issues on this Zoom link, and I want to make sure I don't come across basically choppy or staticky. So my apologies.
No worries. Hugh, we can hear you fine, but if you're more comfortable, please do call in.
Yes, do that right now.
So again, thanks everyone for joining. It's so good to see you all here this evening. We are really looking forward to hearing from Hugh. I think I mentioned that he is joining us this evening in Toronto, Canada. So we are grateful that he is here with us. I know it's on the East Coast, so it's East Coast time. Do we have any other folks joining us from outside of California this evening? Feel free, you guys, to take yourselves off mute. Don't be shy. And put your cameras on. It would be really nice to be able to see you this evening. I do understand that we are right there at that dinner hour, right? Where people might be preparing dinner or doing homework with kids. Lots going on in the evening. So if you feel more comfortable having your camera off, please, that's fine as well. I do see that our 415 area code phone number has taken themselves off mute. Did you want to chime in? All right. Avneet, how are you doing? Are you able to hear me, Avneet?
Yes, I am. Can you hear me?
I can. How are you?
I'm good. How are you?
I am fantastic. Avneet is one of our incoming students joining the class of 2025. Congratulations, Lillian as
Thank
well.
you so
How are
much.
you?
I'm doing good. How are you?
I am fantastic. Thanks for joining us. And Ashton Knowles. Ashton Knowles was actually just offered acceptance into the College of Pharmacy class of 2025 just a few hours ago. Congratulations, Ashton.
Thank you, Mr. Rogers.
Yes, yes. Yeah. So do we have anybody on the line that that is just seeking information and starting to explore careers in pharmacy?
I was about to apply for Pharmaceutical, so I'm in progress on the application, but then I just had a few questions about it. Like,
Great, great. Is this Vanita? Was it
Yeah.
Vanita? Wonderful, wonderful. Vanita, it is a pleasure to meet you. I am always available to answer any questions that you may have, but I do want to just pause a moment and check in with Hugh. Hugh, are you dialed in?
Yes, can you hear me?
I can.
Okay.
Vanita, if you're able to, are you able to stay on the line after we finished our time with Dr. Ngo this evening?
yes, of course.
Fantastic. I'd be happy to talk with you then, so you and I can stay on the line.
Oh, thank you.
All right. Well, let's get started. Dr. Ngo, many pharmacists typically take the traditional route of community or hospital practice. What motivated you to work in the pharmaceutical industry?
Thank you. Jody, I was just going to say, I'm going to give a shout out to Aston for basically showing himself on camera. It's nice to see your face every once in a while. So I appreciate the question. I think this is something I've had to reflect on just because it's been 6 years now since I joined the industry. But if I had to look back at the very beginning and think about my motivations, there are maybe a few reasons that really stood out to me. I think the first is just the sheer variety, right? And by that, I mean, when you think about this world of pharmaceuticals, as we sort of call it, it really never sits or stands still. There's always new developments, new breakthroughs. And I think if you're looking at the current times, you really can't find a better example of what's happening right now with all the work that's done on vaccines and therapies for COVID-19. When I first got hired, we being Gilead, were in the middle of launching one of the biggest curative therapies for hepatitis C. And so for me, coming from a virology training background, that word cure, you just don't hear it being thrown around too often. And so as I was entering the industry, it was a really exciting time for me personally, and I always reflect upon that time with a particular fondness. I think, the other piece to this is that there are aspects of being in the industry, as there are drawbacks, and I'll be happy to elaborate on both things. But from the rewards perspective, it is very rewarding and on many levels at that. If you speak to, people from the industry, one of the things that, I think you'll hear, more or less about it are the financial incentives, right? But I think those things to me are very much secondary, if not third, to the other aspects of work that I find rewarding. First, I'm quite happy as an MSL, but one of the things I really loved learning about was how, no matter where you went to school at the PharmD, there are so many examples of other departments in my company where PharmDs and pharmacists work, whether it's medical information, drug safety and pharmacovigilance. I know of colleagues who've gone on, to other roles, specifically like in clinical research. Believe it or not, the vice president of global medical affairs for my company is himself a PharmD. And those are typically occupied by MDs, right? So those examples to me are hopefully evidence to all of you that, there's a great versatility when you have a PharmD. And this is particularly evident if you look at how PharmDs are employed within the industry alone. If you look beyond industry, clearly you have a vast array of examples there, from clinical pharmacists, the community pharmacists, the people who work for government, right? And those are just things that I'm able to just recall off the top of my head. The final piece that I'll maybe sort of capitalize on or emphasize, I should say, is the job satisfaction. And hopefully you'll see that, just really carry through in some of the other examples that I give tonight. But I would have to say, coming into pharmacy school, I thought I was a 9-to-5 person. And coming out of pharmacy school, I still thought I was a 9-to-5 person. It wasn't until I got to my residency that I was like, you know what, I don't know if I'm a 5 to 9 kind of guy. And when I got to industry, one of the beautiful things that I've learned is that you really get to design your day in the way that you kind of like, and you're in control of your schedule. That doesn't mean you can really slack off, right? Let's keep that in mind. But the reality is, outside of the scheduled meetings that you have and the scientific conferences that you attend, you spend your time however you wish, and you get to decide when you get to be productive. So if you're that guy who starts doing work from 8 p.m. to 1 a.m. in the morning, right? And you still show up at the next day and you still have all your boxes checked off in terms of what you need to do, then no one's going to look twice. And that I think is really the beauty of the job for me personally. I hope that gives you a glimpse of what you were hoping to hear.
It does. It does. Thank you so much. Dr. Sasaki Hill.
I was just going to say, though, Hugh, when you were a student, you were working 24/7 with your mentoring and tutoring program, helping all the students and doing, because all the students, they wake up at, 4 o'clock in the afternoon after class was over. And then you started your tutoring, right? So you worked all the time, or you did a lot of things at different hours when you were a student here. So,
yes, I
did
stand
you tell
corrected.
them, you might tell them about your residency and what you did post pharmacy school?
Yeah, sure. Hopefully I'll have a chance to get into sort of more detail, but just as an FYI, I finished Touro, and then I did a PGY1 with the Veterans Administration. And then hopefully we'll have an opportunity later to talk about my PGY2, which was in HIV pharmacotherapy. And that's really what brought me to Canada. But more on that later, as I'm sure you'll hear.
Awesome. Thank you. Thank you so much, Hugh. So you mentioned that you are a medical science liaison, an MLS. Or an MSL. What does a medical science liaison do?
I smirk and laugh a little bit at this question because even today, my family and even some of my closest friends probably can't tell or describe or fully understand what I do. So I'm going to do my best to try and give you guys a better idea. But I think the first thing to just bear in mind is that when you are working in the industry, no matter what role you occupy, the first thing is that you're considered more or less a brand ambassador for the employer. No different from how Dr. Sasaki Hill is a brand ambassador for Touro University, right? But in my specific capacity, and for anyone else who works in industry, we're a little bit more cognizant of the hat that we wear, because I think there's a public perception of what the industry is, and I'll do my best tonight to give you a better idea into what really goes on behind the scenes when you're doing a job like mine. I would say for my role specifically, okay, my primary responsibility is to establish and maintain rapport with decision makers that we call KOLs, which are key opinion leaders. Okay, and so these individuals, if you think about them, are the top tier physicians in the field. And it's my responsibility, my job really, to form partnerships with them so that I can better understand how I can, one, support their clinic needs, their research needs, but also how they can work collaboratively with industry for a variety of different initiatives, one of which is education. And again, I'll hopefully give you an example there. One of the things that my position often gets confused for is, a sales rep. So when I say I am a medical science liaison or MSL, most people say to me, well, aren't you kind of like a sales rep? I'm like, well, no, because I'm not really selling anything. And this is true because salespeople are incentivized, right, based on the sales. Like they get paid, based on, how many units are sold, in a given quarter or year. I get paid the same, regardless of how the company does, whether it tanked that year, whether it does great, it doesn't matter. And I think that's the beautiful thing about my job. I get to focus on the science, okay? And so that gets to my next part. In your role as an MSL, you're also assigned, in addition to a group of advisors or key opinion leaders, you also get assigned a portfolio. So I work in the field of liver diseases. And so right now, the field that I cover is primarily in the area of viral hepatitis. So that's therapy for hepatitis B, like Boyd, and hepatitis C, like Charlie. Okay. We are currently active in a variety of other liver conditions under this, liver disease umbrella. And you'll hear about it in the news at some point for other things, hopefully, knock on wood, for my own future employment's sake. But the thing to already keep in mind is that, so in addition to this, list of people, this list of advisors that you have to get to know really well, it's kind of like dating 50 people all at once. You have to know everything about them. You have to know their likes and dislikes, what their research specialties are, and what their sort of research and clinical interests are. But on top of that, you also spend your time doing a whole lot of traveling, right? So in addition to being assigned a list, you also have an area, right? And so the way that it typically works is that it depends on where you are situated, okay? If you live in Los Angeles or in another major metropolitan area, typically you won't have to travel very far because your list of advisors will likely be in a very nearby drivable area to where you are. However, I have some colleagues, okay, and I'm going to use the US as an example because that might be a little easier to sort of visualize, who are based in the Midwest. And you want to know what their territory is? Let me get interactive with y'all for a second, okay? Send in the chat box if you want to guess, okay, if you're in the Midwest, how many states you could technically be assigned to. Notice, I didn't say cities, I didn't say or counties, I said states, right? So I'm curious to see what your guess is, okay? What you think might be a reasonable amount that they may assign you as a territory.
Yeah, everyone chatted a guess. I chatted in my guess.
Thank you, Jody. Aston, wow, you have them traveling all over the place. I mean, 10 states is incredible. I don't know if I'd want that job, however flexible it is. 12, okay. Tony, you might as well just cover half the country. Yeah. Evie, I hope I'm saying your name correctly. This is probably more about typical, right? So if you're in an area where your advisor list is pretty spread out, yes, you can be assigned up to 4 states, okay? But that being said, if you are that person who loves to jet set, like you love living out of that suitcase and you like bouncing in and out of hotel rooms, and I will count myself among those people, I mean, it's a pretty good life because every day is a little bit different. You're constantly on the go, and I find that exciting personally. So hopefully that gives you just a little bit of a better idea about what the role and responsibility sort of looks like on paper. I will have an opportunity later to hopefully talk to you about the educational programs that we also run as MSLs. And just keep in mind, I'm giving you a generalized idea because the details are slightly different depending on which company you end up with.
Right, right, right. So what would a typical day look like for you?
Yes, a typical day.
Is there a typical day?
You just answered my question, Jody. The answer is that unfortunately there are, or maybe fortunately for me, there are no typical days. I always find this question is just the most difficult because, you know, your day is different just because of the fact that you're not always in the same office, physician office that, right, on a given day. So again, because you are assigned to a region or a geographic area or number of states, like you don't even have an office. Your true office is anyone else's office that you're sitting in that day. Maybe 30% of the time, it may be your office at home, right? And so those are your sort of admin days where you catch up on things. But the reality is, you know, your office is just, it could be an entire state, it could be 4 states, it could be the entire metropolitan area of Los Angeles. And I think that for me is what makes it atypical. But in terms of the day-to-day responsibilities, yeah, there's a lot of overlap, right, in terms of what you do. And so that could mean anything from responding to clinical inquiries from your advisors regarding any of the products that are part of your portfolio. You know, if there's new scientific and clinical data that are presented at the latest Congress or scientific meetings, you know, you're expected to be on top of them. And these are the conversations, right, or the data that will drive some of your conversations. You may be assisting with some training at a local or national level to your local sales team. You may be working with the headquarter level to assist with, you know, different phase clinical programs, right? Or you may be working with other personnel in your company, whether they're in sales marketing or in clinical research, drug safety, because there are different projects. And quite honestly, you are the medical expert in this team. So they're going to come to you, right? No surprises there. And as I mentioned, you know, in a given month, you know, you could spend 2 weeks of your day doing a whole lot of local traveling. The you know, third week could involve you basically jumping on a different plane and then going to an international meeting. Though that to me is one of the more exciting pieces, and we'll get to that piece. But I think it's super cool that you know, if you like that sort of high adrenaline lifestyle, yeah, it really is really nice. And of course, I'm reminiscing a little bit. You have to indulge me because all of this is pre-pandemic. So if you were to ask me right now if there's a typical day, all days are typical. They are very, very typical.
Right.
And
right. Yeah, it sounds wonderful and glamorous and very, very jet set, and really gives you the opportunity to engage with, you know, different people, different topics, different environments. Very exciting, very exciting. So how did the TUC PharmD program prepare you for this position?
Yeah. So I would say, you know, when I think about my job, there are several competencies that are really integral to this role. I'll highlight 2 of them because they're relevant to this question that you just asked, Jody. Okay, so the 2 of them are scientific knowledge and scientific communication. So these are the 2 skills that, you know, hopefully when you are done with pharmacy school, you're automatically trained to be proficient in them. So when I think to my experiences back at Touro, and specifically back to the rotations that have contributed really uniquely, I think, to my knowledge base, and that I think are still relevant for my current job, it's my rotations in the psychiatric and correctional settings, if you can believe it. They actually did set that up for me. And I credit Touro for making those opportunities happen for me. I mean, it was really important because when you think about the population of hepatitis C patients who are infected with this virus, you know, a lot of that transmission was mediated by IV drug use, right, by illicit substance use, and they occur in a variety of different settings, right? So I'll leave it at that. But the second piece that I also want to sort of bring to your attention is I would also credit Touro for allowing me to to start, this peer tutoring program that Dr. Sasaki Hill had mentioned. And I did this while I was a student. And that experience, okay, along with, I would say, my academic rotations, my academic teaching rotations, that gave me this figurative space and really the confidence to strengthen my presentation skills and my public speaking skills. And when you're in the MSL role, you do a lot of communicating to different audiences, right? Whether it's to another pharmacist, your advisors, or these top tier physicians who you better know what you're talking about, nurses, right? Or you're doing a presentation and you really have to tailor the way that you say something. But you also may find yourself, presenting to your own colleagues, and that's a different style too. Okay, so hopefully that gives you a little bit better idea of how I use my Toro training in my current job.
It does. It does. I wanted to go back and give you the opportunity to talk about your PGY1 and PGY2. Would you mind sharing about that?
Yeah, sure. So my PGY1 was with the VA, and I'm sorry, I'm just catching a question from Anissa for the chat box. Is this like a pharmaceutical clinical sales rep position? So I'm gonna maybe deviate one second, Jody, and just answer this question because I can answer it pretty quick. Anissa, if you can hear me, the answer is it looks that way, but on paper and in reality, it is not. Because here's the difference, okay, and it's a primary difference. If you are a sales rep, you are only allowed to talk about what is in the label. So for Americans, that's your package insert. For Canadians, it's the product monograph, okay? That's it. If it's not in there, you cannot talk about it as a sales rep. As a medical science liaison, I could talk about anything, right? Like if the question came to me about my product, I could talk about clinical data, preclinical data, post-marketing data, data that's just been released through, some scientific meeting. And I think that's the beauty of it, because you really are the medical scientific resource for the advisors on your list. And I can't sufficiently emphasize the incentive, okay? I'm talking salary specifically and things like bonuses. You do not get extra, okay, as an MSL, okay, because your company or your advisors prescribes X number of units of the drug that's in your portfolio. Your sales rep will, however, because why? It's a sales-related incentive, right? For you, you have no reason to go out there and quote unquote promote the product. The thing that I would encourage all you guys to remember is that this position is where you really can have your integrity intact, right? And even more so because you really just think about the science and you present the data in a balanced way, and you still think about the patient, because at the end of the day, all the information that you're providing is what's guiding clinical decisions, right? So that's what I encourage you to sort of bear in mind. So let's go back to the residency question. Yeah. My residency was with the VA, and I chose the VA because honestly, I just love how progressive they are with how much they allow pharmacists to do. They really appreciate the full scope of a pharmacist's practice. And that was really attractive to me, because I just said, you know what, if I'm going to do a PGY1, like I need the experience to take me beyond what I can do on rotations. And I need it to be in a visible and really meaningful way. So, that for me was true, and all the way through my residency. And I would encourage you guys to think about residency really strategically, okay? I would encourage you to not really think about, the name, although that helps, okay? But I'll give you another example later on of why I don't think that really matters, okay? No matter where you end up, and by the way, let me just take a quick survey real fast of everyone on the line. Is there anyone here who is a PGY 3 or 4? I'm sorry, what am I saying? A pharmacy student year 3 or 4? or are you guys all first and second years?
Tony, do you see anyone on the line that's a pharmacy student, 3 or 4?
Yes, not 3 and 4. I'm sorry, first and second.
First and
here.
second.
Yes.
Yeah, so we have a mix, Hugh. We have folks that have joined us this evening that are considering pharmacy as a career. We have folks joining us this evening that have recently joined the TUC College of Pharmacy and will be starting in the fall. And I think that Tony, correct me if I'm wrong, we have a couple first and second year students.
Yes, and then I would add also we have students that have interviews with us
Yes.
that are on the line this conference
Yeah.
with respect to the audience.
Thank you.
Okay. So remember that comment I made earlier to you guys about knowing who your audience is, right? This is one of those examples. So I'm hoping I'm going to do my own advice justice, because obviously it doesn't make a whole lot of sense for me to talk to you guys like you're in your 3rd and 4th year pharmacy school or year of pharmacy school, but think back to, okay, you are a first and second year student, or you are a prospective pharmacy student, right? How does this guy who's taken up the next, 20 minutes of your time, assuming you're even going to stay that long, to make your time worthwhile? Okay, so let's forget a little bit about residency, okay? Residency is fantastic if you have a very concrete idea of what you want to do, okay, as your short-term and even long-term career. Like, you better want it, okay? And so for you guys who are in your first and second year right now, and you like clinical positions or clinically based positions, okay? When I say clinically based positions, I mean like you want to be front and center in front of that patient, okay? And you want to be basically knee deep in all of their therapies, and you want to be a little bit less focused on the dispensing piece, right? You're thinking already about residency. So my advice to you right now is the same advice I gave to myself, okay? Figure out what these people want, right? And the nearest resource that you have, and by people, I mean the directors who are going to be interviewing all of you, if you're thinking about residency. Go to them. Don't wait until you're a 3rd and 4th year student, okay? Start now. Like, just have that conversation, reach out to the faculty and just figure out, like, who's the director of a residency program? And ask them, what are you looking for? And what can I do now as a student to better my chances of scoring one of these programs, a seat at these programs in the future? And the reason why I'm giving you guys that advice is because that's the advice I gave to myself. When I started pharmacy school, I thought I was going to go into academia, right? And there are 3 pillars to academia. There's the teaching, there's research, and there's service. So what did I do? My resume was blank from the beginning, and I had 3 sections. And I said, for the next 4 years, you better have examples running down each one of these sections if you're actually very serious about academia. And so I held myself accountable to that checklist, right? So I'm sure there are other advice that other people give you. I'm just giving you what I did, okay? So in terms of that comment earlier, okay, around, worrying about like where you go, the name of the school. So, I think if I can be very direct about this, it's way much more overrated than you think. Like, it doesn't really matter at the end of the day, because what truly matters is wherever you end up, it's what you do there. Okay, it is what you do when you get there. I think this might have been a question that you might have wanted to ask me later, Jody, but maybe I'll get into it right now. So I want to tell you about my PGY2, okay, and to make this point about names. Obviously, I'm from California, or maybe it's not obvious, but hopefully it's obvious that I'm a U.S. citizen. I went to Touro. I'm a California citizen, resident, all that good stuff. But right now, obviously, I'm reporting to you from another country, right? And so my Canadian adventures, if you may, began way before I started working for Gilead. I actually came to Toronto, the city I'm in right now, to complete my PGY2 in HIV pharmacotherapy. And I did that with an institution called Toronto General, who, when I just checked last week, Newsweek ranked it top 5 of hospitals in the world. So I was really, really proud of them. But the reason why I bring this up is because that decision was a gamble, and I'll tell you why. One, I didn't know a single person in Canada. Okay, so I took a little bit of a risk there. Yeah. But number two, at that same time, okay, that I was accepted to this program, I was also accepted into the UCSF PGY2 program. And so I had a very, tough conversation with a lot of my mentors and my colleagues. And when I said to them, listen, I'm going to choose Toronto over UCSF, they said, you're nuts. You're crazy. Okay. You're absolutely bonkers. Like, are you serious? Like, this is UCSF. And I'm thinking to myself, yeah, I know that. And I'm not negating how difficult of a decision it is. I know how difficult it is. But, okay, there are many reasons why I chose Toronto over UCSF. But one of the reasons that I did was because the program in Toronto offered me rotation opportunities with 2 pharmaceutical companies, with GlaxoSmithKline and with Janssen, right? Who you guys easily recognize because they're one of the top pharmaceutical companies out there in terms of their size. And I mean, let's face it, I am where I am now because I made that decision, right? But the point is, that director didn't care which VA I did it at, right? They didn't care that I went to Touro. They looked at what I did at Touro. They looked at what I did during my residency, and that was enough, right? You have to obviously land the interview. I mean, that goes without saying. But I hope you can appreciate the fact that your education here is as good as anywhere else you're going to get it. And I hope the more important point being, when you're at Touro, or if you decide to go to Touro, that you make the best of it. You kill it. You slay it. You do everything that you need to do, right, in order to get the most out of your education. And that's the most useful advice I can give just about anyone, in your shoes that I can think of. So hopefully that gives you a better idea of how I ended up in Canada, what I did with my PGY2, and all of that good stuff. Let me just pause for a second and see if there's anyone with any big questions that they might want to ask, because I'm noticing, we only have about 15 minutes left into our session here, and obviously this is your time. This is not about me, it's about you.
Yes, Dr. Ngo, there is a question that was sent to me in a private chat. The question is, when did you know that you were going direction to as a MSL, medical science liaison? Was that forged in your 3rd year, 4th year? When did you, discover that?
Yeah, whoever asked that question, thank you, because I think this highlights obviously one of the areas where I think every pharmacy school needs to do a better job at. Okay, and so give me 1 second, guys. I'm having some issues with my phone.
Oh no!
It's like nonstop with this thing. Okay, sorry about that. So if you can believe this, I didn't even hear about the word MSL. I had no idea what it stood for, and I didn't even know it wasn't even in existence as a possibility for PharmD until my 4th year. And if I remember correctly, the first time that I actually heard it was in some kind of a career panel discussion, kind of like the one we're doing right now. So I'm hoping I'm giving back what was not given to me. But here's the funny part, right? When I heard about one of the panelists up there describing their role doing this job, I was like, damn. I'm sorry, can I say that? I'm not sure. You might have to bleep that out, Tony. But I was just thinking to myself, that sounds like a dream job, right? But I also said to myself, that is probably not going to be, within reach for me right after pharmacy school. And to be honest with you, I have to say I lucked out a little bit, because and this is getting to another point that I want to make for you guys. Because it is so atypical for me to land this job outside of residency, and I say it's atypical because most of my colleagues have a lot of experience in industry, and so it's easier for them to apply. And if you are ever curious and you just go on LinkedIn and you look at the job description for MSL, they'll usually say something like, this requires at least 4 years of experience, right? Clinically related or clinically relevant experience or industry experience. So when I read that right off the bat, I was actually, to be honest with you, very, very discouraged. But this goes back to why I believe I made the right choice with choosing Toronto over UCSF, because let's put it this way, okay? I didn't know it at the time, but I was presenting at a grand rounds on one of my rotations, and in the audience was a different MSL from another therapy area from Gilead. And so when I ran into him later at a scientific meeting, he said to me, hey, listen, nice work on the presentation. And he asked me, what are you going to do after you're done with this residency program? And I said to him, honestly, I don't know. I think I need to get a job. It's number one. But I think it's going to involve me, basically crossing the border to go back to California. And he said to me, how would you feel about applying for an MSL position with Gilead? And I said to him, is that even possible? Like I'm just wrapping up my training. Is it too soon? And he said, listen, okay, like you seem to have the skill set that we're looking for. There's no harm in trying. And more importantly, I'm the one recommending you, right? So just keep the faith. So obviously, long story short, I did what he asked, and here I am. But I think if there is one thing that I can sort of give back to you guys, impart in the way of quote unquote wisdom, not that I have a whole lot of it, I feel like I'm still in the infancy of my own career, is that you should basically treat every rotation, every opportunity that you have with someone that you meet in the pharmacy world as kind of like an informal job interview, right? It's because you never know who's watching, who's looking.
Okay.
There we go. We lost you.
My phone is basically just like gone kaput. So I'm back to my audio now. Can you guys hear me?
Yes, we can hear you.
So I would say just maximize these opportunities, because if you're to sort of extend this conversation to industry, okay? If you're coming out of pharmacy school, the quickest, most efficient way to land a job in industry is to do a fellowship. I did not do a fellowship. Why? Because at that time, it wasn't even really on my radar. I knew I wanted to do academia, right? But if you really want that industry position, like academia is the way to go. Unfortunately, fellowships are even harder to come by than residency spots. So we're fighting tooth and nail for really with a whole slew of other applicants, right? And some of those things are out of your control, because quite honestly, like some places will look at the school as being a more important factor. Okay. But before you get discouraged, I'm going to say something else to you, and that is, on your rotation right now, okay, you still have the opportunity to learn just as much about the MSL role. Why? Because MSLs also do presentations to some of the hospitals that you may be at, especially some of these major academic institutions. So if you're doing a rotation, one of the things you might ask your preceptor is, hey, do you often have, or do you ever have MSLs come in to present at a lunch and learn, or is there any opportunity for me to talk to an MSL? And that's how you start up a network, right? That's how you build a name for yourself. That's how you start learning about things, right? Because if down the road, you still have that contact and he or she really likes you, right? That might be the person who ultimately refers you after you've done more training. So I just want to say, like, it's never a dead end, right? Like, and I'm hoping I'm an example to, in just that regard alone. Just be aware of the opportunities, be open-minded. I mean, this is coming from the dude who's living in Canada, right? So, I mean, I don't know, if you missed that point, I can't help you out tonight. But that is my way of saying, be open-minded. Don't always focus on the name, right? Wherever you land, like, do a kick-ass job, like, just nail it. You know, you may cry a few times, and that's okay too. You know, everybody, you know, needs to like cry a few times. That's fine. But just make sure you don't cry in front of your preceptor. That's all I could say. Just really make the best of all of your opportunities, and you can't go wrong, you know, as long as you gave your best at the end of the day.
Dr. No, I think Avneet has his hands raised. I just want to.
What else can I answer for you guys?
Yeah, neat.
Hi, Hugh. I have a question about your residency. So you did 1 year in the States and then 1 year in Canada. And what would you say was the biggest difference between your residencies in 2 different countries?
Avneet, if I'm hearing you correctly, my apologies, my audio is sort of going in and out. If I understood remember your question correctly, it was, what was the differences in terms of my residency in Canada versus the US? Is that right?
Yes.
Okay, great. So I would have to say not a whole lot. And this is something that surprised me as well, because you're not really prescribing, right? You're not really doing any different. I mean, you're still under a preceptor everywhere you go. Some of the scope might be a little bit different, just because some preceptors are maybe not necessarily as quite as open to having pharmacy, you know, residents go through there. But every site, you know, always got 1 or 2 preceptors are not quite ready for pharmacists to be that much more, you know, hands-on. But I would say I didn't really notice a big difference. Like, I mean, I was still asked for recommendations. I was still writing clinical notes. I was still seeing patients. To me, it was just like any other residency.
Okay, I have a little follow-up question. So is there a difference between the style of practices in the 2 different countries?
Yes, very. Huge difference. So Canada is just getting around to getting into this whole PharmD degree as that advanced degree for pharmacy practice. Up until this point, it was still basically a bachelor's program, but because they're now setting up, you know, residency programs, and there's been some changes. I don't know the full details, so I can't get into it, you know, too much. All I can see is they're transitioning to this PharmD program. But what that means is that because they're still in its sort of infancy, there are few institutions where you see a similar scope of practice for pharmacists. In general, a lot of pharmacists are still doing a dispensing or primarily dispensing focused role. So if you're looking for a clinically driven position, you know, where you have a broader scope of practice, unfortunately, it's still a little bit more limited in terms of opportunities.
Thank you so much.
Sure.
Any other questions?
Dr. No, just for this audience, can you elaborate in the difference between the residency and the fellowship? You talked about it, but in layman's term, and as far as, you know, the breadth and the scope of practice, is there many pathways, right? Can you elaborate on that, sir?
Thank you, Tony. Tony, you got all the good questions back there. So my very, shall we say, elementary understanding of the difference between fellowship and residency is that when you are pursuing a residency opportunity, your focus is on clinical skills development, right? You're trying to take that PharmD to that next step. You're trying to like learn how to take care of patients better. You are trying to be like master of pharmacotherapy, right? And as you go from PGY1 to PGY2, by the way, that focus is narrowed in even more. So I gave you an example of me being HIV as that narrowing kind of move. When you are thinking about a fellowship, okay, it is basically non-clinically oriented. you're very, you're still knee deep in the science, so don't get me wrong. But when you're pursuing fellowships, my understanding is that you want to work in research and you want to work in industry, but that you don't want to work necessarily in terms of like patient care. That is the primary difference for me, and I believe that is true.
Good. We just have a few more minutes with Hugh. Does anyone have a question that they are just dying to get answered tonight?
It's now or never.
It's now or never.
I believe it or not, I'm actually adjunct faculty with Touro. So for better or worse, you're stuck with me, or should I say, I'm stuck with you. I'm around, guys. I really am, and I reached out to Dr. Sasaki Hill because I said to her, when I was here, we did not have rotations in industry. There wasn't even really an opportunity to talk to really anyone in the industry. And so I wanted to change that. That for me is my way of giving back to the school. And by saying, I want to at least create an opportunity for someone to know someone who works in the industry. I want for them to be able to interact with me and learn, what a sort of day-by-day play looks like. So that's something you may or may not hear about as you're, getting into the rotations business as a third and fourth year. But I at least wanted to let you guys know that at Touro, even though I'm not on the faculty page, you do have somebody in the sort of faculty who can give you a little bit better idea if you're thinking about industry as a future position. Okay.
Oh my goodness, we've only got like 3 minutes. Avneet, I see your hand up again. Do you have another question?
Yeah, listen, guys, it's already way past my bedtime, so I'm good to stay for as long as you need me. Okay, so I'm going to take the first question from Bridget, and this is assuming Tony doesn't, sort of end the call on us and be like, your time is over, buddy. You're done. So, okay, can I speak to the dual degree, PharmD MPH? And Bridget, thank you very much for your question. Honestly, guys, we are living in a very competitive world. In case you didn't get that memo, okay. Credentials do speak, a lot, and it's not the credential, and it still comes back to my earlier point about what you did with that credential, right? So one of the things that I think for me seems at odd at first about the MPH and PharmD is that when you're an MPH degree holder, okay, your focus is on population health. You're looking at things from a bird's eye view, and you're more focused really on the prevention as opposed to, basically getting in there before patients are really, really, really sick. So for me, when I was doing this, I had to sort of reconcile, how do these two degrees work together, right? And so one of the best examples that I can share with you is, so in my work, because I'm such a crazy person that likes to add more work to himself on his plate, I always find opportunities where I can do research with my KOLs, my key opinion leaders. And this is not something you'll hear a lot about from other MSLs. It's kind of that doing extra on the work that you only take on, again, if you're a little bit crazy. But I use my MPH because when you go through your MPH, like you learn research methods, right? You learn biostatistics, you learn about prevention. And some of the posters that I've done, and I did say abstracts and research posters that I've done with my KOLs were possible because I was able to pull from that knowledge base from my MPH. So what's the practical takeaway here for you guys? Well, I did mine as kind of like a MPH first and then PharmD. So I got a lot of my didactic, sort of courses and credits out of the way. And during the summer, I was able to sort of catch up on the remaining courses and, my sort of thesis, if you may, of that, that final project. So you can do it like that. Or if you're, if you want extra work for yourself, then you do that MPH overlapped with your PharmD at the same time, but I'm just gonna let you know right now, like you better be prepared, like you better be on top, because that's a lot of classes, right? But
right. Well, not necessarily, because you know,
no?
at Touro, I mean, we a lot of what our College of Pharmacy students are completing within the College of Pharmacy for their PharmD is transferable to our Masters in Public Health program. So to obtain a dual degree, with the dual degree option here at Touro, the students that are pursuing the dual degree in public health are only attending classes during the summer months. So it's 3 summers, 2 summers didactic, and then 1 summer field study. And that's it. And then everything else is transferred from the PharmD. So yes, it keeps folks going, right? They don't get that summer off to go travel and have fun. However, wonderful program and totally worth it. Yeah.
I stand by that. Yes.
Yes.
Dr. No, I didn't want to overlook, I know time is pressing. There is a question in the chat with regards to ethnopharmacology. If you can see that, I can repeat it and address that in your studies with us as to how you embody that or saw that during your time as now an alum.
Yeah.
Yeah. So I have to say, this was not something that was a big focus. At least, how do I say this? Like it wasn't like its own course, right? You're going to find themes of ethnopharmacology, and I have to think, you know, as to what my definition of ethnopharmacology is around that. But basically, whenever there's an opportunity to highlight differences between different races, ethnic groups in terms of how they respond, for example, to pharmacotherapy or their predisposition to a certain disease, you'll see that reflected in the actual courses. But if you're looking for like, you know, I want to take a rotation or I want to, you know, take a course and the title is ethnopharmacology, I have to disappoint you there, because I don't think any pharmacy school will sort of offer that to you. Now, that being said, if you said to, let's say someone calls pharmacy, hey, so-and-so, I noticed this is your research background. And, my specific research interest is in ethnopharmacology. Do you have opportunities for us to collaborate, or is there a research question that you think we can further work on? Then I would start there, right? So that's how I'm turning this into although there's no XYZ opportunities, you can still basically pursue what you're looking for in that specific capacity. So hopefully that answers your question, Anissa.
Thank you. And then I believe Avneet has his hands up too as well. Avneet? Yes,
Avneet, did you have another one?
Yeah, I just had 2 mini questions. So my first one was, why did you choose Turo? And the second one was, what was your favorite part of your 4 years at Turo?
Great question.
Avneet, you're trying to earn some extra points here. So I would say, I'll do the second question first. How about that? My favorite part of Turo was, I would have to say, I'm really surprised at all of the different initiatives that Turo allowed me to do. And one of them, and I reflect upon very fondly, thinking back, is that peer tutoring program. I reflect fondly upon it because there was no peer tutoring program when I started. By tutoring and by peer, basically it was, if you had enough time and interest and you want to get with your friends at a Starbucks, that's your version of peer tutoring. I wanted to formalize the process. I wanted to be able to offer students who are looking for tutoring to be able to have colleagues who are very confident about a subject material and give them the opportunity to work with that student and be tutored by them. So that's why it's peer-to-peer. And all of this was created basically from scratch. Like I had to basically recruit this team, many of whom initially worked for free before I was able to pitch it to, the powers that be at Touro to pay these tutors who are working really, really hard. And we did a whole lot of things. And I think one of the things I'm proud of is the fact that, this was an opportunity to not only just be a mentor to your colleagues, but when some of the tutors left the experience, like they had a few more bullet points on their resume about what they did, right? They were able to present. So that improved their public speaking skills. They were able to really like hone in on a particular subject area and be like the true master in that therapy area. And, you know, this is just something that I just felt was like, it just grew out of a need that I created. But I bring this to, or I credit Touro because they could have said no to me. They could have said, no, I don't really think that's a great idea, right? But they said, no, it sounds great, do it, right? Do you, like, get started, you know, get everyone tutor. And I was like, okay, thanks. Let me do what I can. So anyway, the takeaway for you guys is, if you come to Touro, if you make that decision and you see that there's an opportunity for you to fill a need, to do something different, okay, I would go to the administration and just lay it out for them and say, hey, listen, I noticed this. Is there an opportunity for me to do ABC? And the nice thing about being at a relatively newer school like Touro is that you'll have the opportunity, I don't know, maybe to start something fresh. Why did I choose Touro? Well, you know, you guys hear a lot about this 2+2, but I'm gonna re-emphasize the 2+2, and that is, not every school will offer you the same number of rotations, right? And so all this time I've been saying quality over quantity, right? And that still holds true. But imagine, what if you can get both quality and quantity, right? So instead of 6 or 7 rotations that you can normally get at a different school, if you're like me and you want to be done with your didactic courses quicker, right? So sooner as opposed to later, and you want to get out there and you want to start seeing patients and doing rotations, this might be the program for you. And as I was saying earlier, every opportunity in a rotation is like an informal job interview. So imagine how many more future potential employers you get to liaise with as a result of having that number of additional rotations. Okay, so I'll leave it at that. And the last piece is back to that MPH piece. I mean, there aren't many schools that offer like a joint degree, right? And so I was like, this is money. I mean, now literally, because you can, you know, just really make the most out of, you know, maximizing the potential from both of these degrees. And I can't sufficiently emphasize or remind you guys that it's not about where you do your residency. It's not about, you know, where you did your rotations. Just make sure that when you come out of that rotation or that residency, you really know, okay, the value that you brought there and be able to communicate that. That's way more important.
Oh,
Thank you so much.
such a wonderful evening. Thank you so much, Hugh. It has been amazing having you tonight. I want to be respectful of everyone's time, but I also want to invite anyone to stay on the line. If you have any admissions questions, I'll hang out for a little bit. But I do want to be really respectful of Dr. Hugh Ngo's time. With that being said, thank you so much, sir. Such a great evening with you. We appreciate you.
I appreciate you, Joy. And Tony, thank you. I trust you're going to edit out anything that I said. Was off, you know, yeah. So thank you. Avneet, thank you for all your questions as well. I'm trying to make sure I give everyone an opportunity. Obviously, because I'm with Touro, you guys will have my email if you need it. So please reach out. And you know, for all of you guys that are thinking about Touro, I wish you the best of luck. And honestly, I wish you the best of luck no matter where you go. Okay, just make sure you really make the most out of it. For those of you guys who are at Touro in your first, second year, just start thinking strategically. Okay, think strategically. And if you need help, essentially with you know, any kind of advice, like I would just really reach out to the people teaching you and ask them for advice. You know, like, don't be shy. Like, that's what they're there for. That's why you're paying tuition. That is right. Bushra, nice to see you again. I think I remember us chatting at some point. And thank you very much for the compliment. That's very kind of you. Yes. And
Thank you, Dr. No, as well. I'll hang out with Jody. I'd love to speak to Anissa, who asked the questions about, you know, the opportunity as it relates to, you know, cultural and, of course, dealing with, you know, those things. I think it's important. We do have a track system, and I've turned it to Jody to conclude. You know, we look forward to chatting with you further.
Thanks, everyone. Have a fantastic evening. I am going to put my email in the chat. If anybody has any questions for me or wants to reach out to me, I think a lot of you already have my email, but here it is again. I am always available, well, not always available. I am available during business hours, probably even more available now that we're kind of all working remotely. I check on things a little bit more frequently, but yes, feel free to use my email address, reach out to me. I am more than happy to set up phone appointments with anyone that has questions. I'm also more than happy to set up individual Zoom sessions so that we can chat. And I'm here right now for anyone that has any questions for me that are admissions related. Does anyone have, Vanita, I know that you had questions, but you also mentioned that you wanted to give me a call.
Yes. Should I just stay after, or should I just give you a call?
Whatever you're most comfortable with. It's, you know, I certainly don't want to take up your evening. I'm available tomorrow from 8 to 3, so you can give me a call tomorrow, or we can hang out.
Okay. Let me see how many students there is. If anyone.
Yeah. Avneet, do you have any questions?
Yeah, I messaged you privately about, so I paid my deposit to hold my seat. So
Yeah.
I know the tuition deposit is due May 15th. Is there anything else due before May 15th that we have to do, or?
There is not. So unless, of course, you're still working on finishing up your prerequisite courses. And if you are, I wouldn't know unless I looked directly at your file if you had any of those prerequisite courses pending. So yes, the second deposit is due on May 15th. However, if you are having challenges, we are living in a weird state of affairs and have been for the last year. Avneet, just reach out to me and we will figure it out, okay?
Okay.
And then of course, if you have any prerequisite courses that you need to complete, make sure that you're working towards those to have those completed prior to the program beginning. And then once you have completed all of your pending coursework, make sure you get that final official transcript over to me.
Okay, thank you so much.
Yeah, you're welcome. You're welcome.
Thank you.
Anything else?
No, that's all. Thank you so much.
Have an awesome evening.
You too. Thank you.
Thank you. All right.
Hello.
Hey, Anissa.
How are you all doing this evening?
Good, hanging in there, feeling like feeling like it's midnight because of the time change.
That's yeah. Yeah. I had a question being that I would need to complete my prereqs as I graduated previously with more of a liberal arts background. However, I became interested in pharmaceutical studies because I've done some research on my own based upon human leukocyte antigens and kind of the role that plays and how it can affect different individuals and how they respond to different drugs.
Yes.
So I know that's not a basis for just becoming a pharmacist, but that was kind of my thoughts upon it.
Sure, it's driving your interest, and that's fantastic.
And so I guess I was just wondering, for prereqs, how do I know that they will transfer and everything is correct? And then also, I mean, my interest would be that in of itself, you know, because I previously thought, okay, so a pharmacist goes to a pharmacy. Obviously, my interests were more academic.
Right.
And so Dr. No kind of answered that, but I wasn't really sure how Toro does that. I mean, I know he said there's not a specific course.
There isn't. And so it's really integrated. You're not going to be able to achieve a PharmD without exploring all avenues of pharmacy, of becoming a pharmacist. So you'll get the foundation and the didactic knowledge that all pharmacists receive. But in addition to that, here at Touro University, California, we do have that 2+2 curriculum. So you're going to get through the curriculum within 2 years, and then you're going to dedicate 2 years to clinical rotations. Remind me, Tony, is it 4 of them that are electives, where you can be really, really specific in terms of the types of rotations that you would like to pursue based on your interests. So you're going to get that exposure through your clinical rotations to community pharmacy. You're going to get exposure to hospital pharmacy. You're going to get exposure to you know, acute care and all the traditional ways of being a pharmacist. But in addition to that, you're going to have those 4 rotations. And then beyond that, you are going to have the opportunity to pursue a residency or a fellowship, as Dr. No was talking about. But because you're so specific, I'm wondering, Tony, do we have a faculty member that would be like a really great person for Anissa to talk to about her particular interest?
Yes, so I think we teach Anissa on a track system, biological sciences, track 1, pharmaceutical sciences, track 2, social science, behavior, administrative ethics, right, the law, Medicaid, Medicare, track 4, clinical sciences. This is where the application of core knowledge, principles, and processes of clinical settings, primarily through, of course, presentation, SOAP and exercise, analysis of therapeutic outcomes. And I think to your question that you asked, Anissa, is a great question, and be an innovator, as our curriculum is innovative. Ethnopharmacology, if you're wanting to, you know, dabble into that more, grassroots, because it's very unique and very special, because what does the face of a patient look like, right? And what type of remedies are they using, whether that be folk, cultural, or otherwise. This is where, you know, obviously being a leader that you are going to be in your interests, you can really, with the clinical application, the clinical side of tracks, we do have pharmacists that are clinical that do in approaching the therapeutics, you know, looking at that whole person concept. And I think you can gain from that, and you can, you know, dive into it, because you have to have that foundation to get your PharmD ultimately. And I'm hoping that answers your questions with respect to ethnopharmacology, because it is a very sensitive, you know, people's diets, exercise, intake. Is very important. So I think you can grow in that area. And if that's your interest, you can possibly do a fellowship or a residency, as Dr. Noah's talked about, you know, with his HIV or, you know, training in his residency, advanced training.
You know what I'd like, Anissa, if you could grab my email out of the chat, shoot me an email with your contact information, and I am going to find some faculty experts to reach out to you and just chat with you about your interest a little bit more. Would that work for you? Are you open to that?
You're muted, Anissa.
Oh,
She's
I was
muted.
like, oh, I can't hear Anissa.
She's muted.
Yes, I'm sorry. That will work for me. Thank you very much.
Awesome. Thank you. Thank you. All right. Anything else, Anissa, before I check on Vanita?
No, thank you. That's all. Thank you very much.
Yeah, pleasure to meet you.
Likewise.
Same.
Vanita, how can we help you? So you've already started your application in PharmCast, right?
That is correct.
Awesome.
So I am actually a pharmacy tech for the last 8 years, and I'm it's gonna be 6th year with Kaiser, and I'm transferring to inpatient next week. So my question is, my transcript is not the best. I'll be done with all my prereqs by end of May.
Great.
So is this school like really like into like, because my transcript, I had to redo a lot of classes, so my transcript is not the best.
Right. So what we're going to look at it, and Vanita, you are certainly not the only one that has had that experience. You know, throughout life and throughout folks' education, there are peaks and valleys, right? There's times that are a little more trying, and there's times that we're really shining. So I look at transcripts every single day. Our admissions requirements are posted on our admissions eligibility requirement page. What we're looking for is an overall GPA. So that would be inclusive of all of your education, an overall GPA of 2.75 and an overall science GPA of 2.75. If you fall a bit below that, what I will do is I will present your application to the admissions committee, which is comprised of College of Pharmacy faculty, and they will review your application to see if they are willing to extend you an interview. We call it a faculty review. So they'll take a look at that and they will really review things in further detail. So they'll look at your essay, they'll look at your circumstances. So if you have had some challenges, you're probably most likely going to want to address those in your personal statements, in your essays, wherever those questions arise. Just be really forthcoming so that, you know, we, myself in admissions, as well as the admissions committee, can get a really full comprehensive picture of what has occurred. Are you concerned about your overall GPAs, or are you concerned about just your coursework kind of varying in terms of the grade?
Like my coursework, like my previous, like when I started, and then I'm also like, I'm a community college student, so that also.
Yeah, no, that's fine. So, you know, our admissions, as a matter of fact, I offered acceptance to several community college students coming directly from community colleges just today. So our admissions requirements are a minimum of 72, completion of a minimum of 72 units. And then of course, those course prerequisites that do need to be completed in general chemistry, organic chemistry,
Yes.
microbiology, calculus, and physiology. Those can be in progress at the time of your application, as long as they're completed prior to matriculating, so starting in the fall. We can offer you an interview and offer you acceptance with those courses pending.
Okay.
Yes, yes.
Vanita, I've also posted the admissions requirements in the chat for you.
Yes.
For you to review. But sorry, not to cut you, Vanita, your question.
So okay, so when the interview is coming up, so my transcript looks horrible. Like my previous, like I had to redo most of my classes. So does that affect like the interview process of it, because you're not seeing this semester's transcript?
You know what, it's difficult for me to say, Vanita. Would you be willing, okay, first of all, have you completed your PharmCast application and you're just getting ready to submit it, or you're still working on it?
Still working on it.
Okay. Do you have copies of your unofficial transcripts that you could send to me for review? And then I could be really specific with you.
Okay. I can take care of that. And then I had one more question. How many seats has been filled already?
I am not really sure right off the top of my head, because I just extended a bunch of offers this evening. So we do accept our right around 100 students for our incoming classes. So small, nice group of individuals, and we have plenty of seats available. We will we will be hosting interviews every Wednesday for the remainder of the admission cycle. So yeah, we have seats available. Yeah, I would really just encourage you, to keep working on that application. Send me a copy of those transcripts, and then maybe I can set up a Zoom session where you and I, or even call you on the phone if that's more comfortable for you.
Yeah.
We can talk about what I see there.
Okay, thank you so much.
You are so welcome. You are so welcome.
And that should be all. Thank you, Tony. Thank you.
I look forward to hearing from you and working with you.
You're both welcome, Anissa and Benita. It's our pleasure to help you. And we're here to help and give you feedback as you're asking these questions.
Thank you.
You are welcome.
Bye.
All right, everybody, have a good evening. I am going to,
Anissa, you have another question, Anissa?
I don't think she's on the phone because I'm not seeing her little phone thing. She probably just forgot to log off. I will log her off.
Awesome.
Thank you, Tony. Thanks for hanging out.
No problem. Anytime. Anytime.